Hi, this is Dr. Tom McFadden of Advanced Cosmetic Surgery. We're here in Greenville, South Carolina. We do the full gamut of surgical and non-surgical cosmetic procedures here. And let's see what video topic we're going to cover today.
Hey guys, I'm Dr. Pete Felice, and I'm going to talk a little bit today about the difference between liposuction versus tummy tuck. And the simplest way that I talk to my patients about it is liposuction is for fat, tummy tuck is for skin and fat. So main difference being liposuction is really going to address the tissue underneath the surface of the skin. Sometimes patients will come in and say, I just have a little pooch here, or the love handles have always been an area of my body that have been difficult for me to control the shape of with diet and exercise. And if they don't have a lot of loose skin, if they don't have a lot of extra skin, liposuction a lot of times is a great operation for that, because all we're doing is taking out that fat from underneath the surface of the skin. Now, I do liposuction as part of my tummy tuck procedures, but we need to do a little bit more if a patient requires a tummy tuck. Namely, we also have to remove some of the extra skin. So while liposuction is only going to address fat, not the skin, tummy tuck is going to address both the fat and the skin, so it's a more complete choice and a better operation for patients that want to remove some of the extra tissue and some of the extra skin. So pretty much every patient that I do a tummy tuck for gets some sort of liposuction, but not all patients that get liposuction need to have a tummy tuck. And the difference is, well, what's the area that we're targeting? Are we trying to remove skin and excess fat? Tummy tuck. Or are we just trying to remove a little bit of extra fat, a little bit of extra tissue underneath the skin? That's the liposuction procedure. But they can be combined at the same time. So when I do liposuction with the tummy tuck patients, it's done in the same operative setting at the same time. You don't need to come back at a later time just for that first surgery. We combine them both together in the operating room. So the cost of the operation depends on what are we doing? Is it a tummy tuck? Is it liposuction alone? Is it tummy tuck with liposuction at the same time? That's going to be factoring into the overall cost, the type and time required in the operating room to do the procedure. We also will look at certain things such as the type of anesthesia used, whether or not there are any other procedures done simultaneously. All of that goes in to factor what the ultimate cost is. Normally, insurance companies won't cover aesthetic or cosmetic procedures, so if you're doing your abdominoplasty or liposuction just to look a little bit better, chances are insurance isn't going to cover that. But there are some patients who do need reconstructive or but there are some patients that will need some sort of reconstructive or revisional procedure for abdominal contouring that insurance may cover. It's just important to make sure that you talk to your surgeon and patient coordinator as well as your insurance provider to know what is or what is not covered by insurance before you go forth with any operation. After liposuction, patients are back to their day-to-day activities pretty much within just a matter of a day or two. Anti-inflammatory medications are usually all patients need to keep their discomfort under control. Occasionally, you may need a narcotic medication, but by and large, patients that I do liposuction for do fantastic without ever requiring a narcotic medication. I do tell my liposuction patients not to lift anything heavier than 15 pounds for the first 2 weeks, and I don't want them doing any overexertional or strenuous activity till about 2 or 3 weeks after the operation, at which point, if they're looking well, if they're feeling well, I let them return to normal activity as tolerated. In terms of the tummy tuck recovery, I tell most patients to expect about 4 weeks before they can get to their normal activities, both in the gym, lifting, cardio, and also just feeling back to their normal activities with work and daily life. Whereas most patients after an abdominoplasty are going to take about 5-7 days to start to feel back to their normal selves. I don't want them doing any heavy lifting more than 15 pounds for the first 2 weeks of surgery, and I also don't want them doing any overexertional or strenuous cardiovascular activity till about 3 to 4 months after the operation. So patients can have liposuction procedures more than once. In fact, I see a lot of patients at my practice that will come to me after having liposuction from a different physician, and they want to have a little bit more aggressive or a little bit more refined treatment. So yes, short answer is you can have liposuction more than once, even in the same areas. If patients continue to be pretty diligent with diet and exercise, they're going to notice that the results of that operation continue to look great for months and years down the road. Every once in a while, it is necessary to do a revision abdominoplasty if patients don't like the way that the contour is, or if there's a problem with the scarring or a problem with the overall shape. But for the most part, patients do great after one operation and continue to look and feel well down the road, as long as they consider to do the things that are right for their diet and exercise program. So thanks so much for watching this video to talk about the differences between liposuction and tummy tuck surgery. Be sure to subscribe, hit the like button, and stay tuned for more videos and content like this. Thanks so much.